In this next section, we will discuss the multiple different types of opioid medications, their different receptors, and indications for their use. In this section, we'll discuss opioid medications. Opioids are a large class of molecules that are actually polypeptides. The way they work is by increasing analgesia, which is equal to increased pain tolerance and decreased perception and reaction to pain. Opioid receptors are G-protein coupled receptors. They have multiple subtypes, including the mu, delta, and kappa receptors. The mu receptor is the most important for pain control and is the one that binds morphine. Some drugs may activate one receptor subtype and antagonize another receptor subtype in the opioid receptor family. The opioid receptor mu is responsible for many of the wanted and unwanted effects of opioids. By activating this receptor, you can see analgesia, euphoria, sedation, dependence, and respiratory depression. Whereas the activation of the kappa receptor, for example, can cause dysphoria and can cause analgesia and sedation. Opioid drugs will vary by their properties, their ability to produce pain control, and other actions and side effects. The prototype opioid medication currently is morphine. Morphine is considered a full agonist at the mu receptor, and it causes maximum pain relief. Remember, the adverse effects of opioid drugs may include respiratory depression. These patients may actually become hypoxic. Opioid drugs can also classically cause constipation, nausea, and vomiting. And there's a high abuse potential in these patients as well. The triad of opiate intoxication includes meiosis, or constricted pupils, respiratory depression, and coma. If a patient comes into the emergency room displaying these side effects, you should immediately think about opioid overdose. Most patients that exhibit these symptoms will receive Narcan, or an opioid antagonist, to release the opioid medication from the receptor. As I said, naloxone or Narcan is an opioid antagonist. It's a full mu opioid antagonist, and it will displace morphine from that receptor. Opioid antagonists such as Narcan are used very commonly in either suspicion or actual known opioid overdoses. They can actually trigger a withdrawal symptoms in some patients. Naltrexone is related to naloxone or Narcan. It's often used in alcohol craving situations, and it's used for alcoholic patients. There are other uses for opioids besides simply pain control. Loperamide and diphenoxylate, also known as Imodium and Lomotil, are commonly used to treat diarrhea because of the ability of these opioids to slow down the gut. Diphenoxylate is commonly given along with atropine as the combo pill Lomotil, which works very well in patients that have irritable bowel syndrome. Opioids can also be used to treat cough, as we see with the medications codeine and dextromethorphan. Codeine is classic for causing constipation. Codeine is actually converted to morphine in the body. Again, morphine is the prototype opioid analgesic. It has low bioavailability, so it's much stronger when given intravenously. The active metabolite is morphine 6-glucuronide. This is one of the few glucuronide molecules that is an active metabolite. It also contributes to analgesia and is possibly nephrotoxic. Codeine is also known as methylmorphine. It is metabolized to morphine by a cytochrome P450 enzyme. Patients that do not have a strong level of this enzyme in their body do not get therapeutic effect from codeine. It's less effective than morphine, and it's found in some cough suppressants. Other opioid medications that you should be aware of include oxycodone and OxyContin. These are medications that are semi-synthetic. They're intended for chronic pain treatments. These can be formulated either alone or in combination with either Tylenol or acetaminophen or an NSAID such as aspirin. These pills are often commonly given to patients that have chronic pain, and these patients will take extended release pills. Vicodin or hydrocodone is a medication that's very commonly prescribed today in America. It's a short-acting opiate that's usually formulated with acetaminophen, but it can also be formulated with an NSAID. It's very popular for short-term pain control, but it can have all of the side effects that we see in other opiates. Fentanyl is another very short-acting synthetic opioid. It's very potent. It's about 100 times more potent than morphine gram to gram. Fentanyl is very effective because it can be given transdermally or intravenously, and it has quick on and quick off properties. And it's widely used in an anesthesia situation. In the intensive care unit, when a patient is about to be intubated or has already been intubated and needs to be sedated, oftentimes we will give fentanyl along with a benzodiazepine in order to achieve pain control and sedation. Meperidine, also known as Demerol, is another popular opioid analgesic that has become less popular these days, mostly because of its abuse potential. It also creates in the body a toxic metabolite known as normeperidine, which can cause seizures and can be fatal. All opioids run the risk of developing tolerance and dependence. Withdrawal from opiates can be very severe. Classically, these patients develop anxiety, lacrimation, rhinorrhea, sweating and yawning, goosebumps, hot and cold flashes, muscle cramps and spasms, and GI distress, including diarrhea. Another medication you should be aware of is the partial agonist buprenorphine. This medication is commonly given to patients that have opiate dependence and withdrawal. The typical analgesic effects can be seen in naive individuals, and it may also trigger a withdrawal in patients that are taking an opioid agonist such as morphine. Other opioids you should be aware about are methadone, which has a long half-life. This is commonly used in rehabilitation of heroin abusers. It will prevent a withdrawal syndrome, but it doesn't cause as much of a high as heroin does. Users of methadone will not test positive on a drug screen. Propoxyphene is a less commonly given opioid that's weaker than codeine in terms of its pain control, but it's more toxic. It's part of the pill called Darvocet when it's given along with acetaminophen. This medication is not commonly given in the United States. This concludes our section on opioid analgesics. Our next section will involve dopaminergic pharmacology, including anti-Parkinson's medications and antipsychotic medications.